Welcome to the Nerve Guys podcast, where we discuss movement, performance, and rehabilitation through the lens of the brain and nervous system. The Nerve Guys podcast is hosted by Gareth Kelly and James McCambridge. To find out more about the Nerve Guys or to book into our online or in-person training programs, please visit thenerveguys.co.uk. The Nerve Guys podcast is sponsored by Elite Vision Sticks. Every day, athletes of all levels are reaching their full performance potential with Elite Vision Sticks. Pick up yours today. Hello, everyone, and welcome back to the Nerve Guys podcast. Today, I'm joined by concussion expert Natasha Wilch. So this is one I'm really excited about. Concussion has been something that I've always been really curious about, just because of how overwhelming it can seem in terms of when you have it, but also when you're trying to treat it. There's a lot of information out there that tends to conflict with each other. So I think hopefully this is going to be pretty eye-opening and wonderful. So Natasha, thank you very much for joining us. Do you mind if we start off, if I just ask because we treat people with concussion as it's a little part of what we do. You've taken it on as this is your whole thing, and why is that? Why did you decide on concussion? Why is it so why is it worth that amount of time, I guess, is in your opinion?
Yeah, I'm excited to be here. Thank you for having me. Concussion is all I do right now, for sure. Concussion and brain health. So I own a clinic. So I'm from Nanaimo, British Columbia, Canada. So I know we're across the world from each other. So when I opened my clinic 7 years ago, I actually treated all neurological. So I treated stroke, I treated Parkinson's, I treated MS, spinal cord, kind of did it all. And then one day there was a client that was referred to me by an occupational therapist in town, and she had a concussion that wasn't resolving. And this woman walked through my clinic door, and I will never forget her name. I will never forget what she looked like, because I didn't know what the heck to do. Because a concussion is not a stroke. A concussion is not Parkinson's. And I'm a physical therapist. So in physical therapy school, we got 1 hour on concussion. And it was all about, here's how you identify a concussion in sport, and then it gets better. That's basically what I remembered. So with this woman, I really had to kind of dig back into my brain and my knowledge and be like, okay, concussion is the brain. What do I know? What can I test? What can I look at? And basically she kind of lit this fire in me. And it brought me back to a spot earlier in my life. And I'm trying to cliff notes this so I don't take forever to tell this part. My dad experienced a brain injury when I was 17 years old. And so a log rolled off the truck on the back of his head. And back then, that was 21 years ago, you didn't rehab brain stuff, right? And no one educated him. No one educated my mom. No one educated my brother and I on what that could look like in our life. And my dad dealt with dizziness. He dealt with headaches. He dealt with light sensitivity and sound sensitivity, short-term memory issues, would just zone out. There was a lot of things that came out of this for our family that impacted his life, but also our lives. And the fact that 21 years later, as I started getting more concussion clients in my clinic, I was seeing these same trends, hearing the wrong, crappy information being dispersed. It just kind of lit this fire in me to be this is not okay. This is unfreaking acceptable, especially in today's day and age, and we need to do something about it. So that's kind of the heart of my why. And I've always been I just love to help people as well, and that's the passion as to why this is in itself so important to me.
Yeah, that's really cool, and I think I can definitely relate to kind of what we were talking about faulty information, or just a lot of weird information. And in my experience, I generally find two kinds of people with concussion. There's one type, which is, I've just been punched in the head, I've got all these symptoms, but yeah, it'll go away, I'm fine. And they will do nothing. They, next day they're back at work doing all sorts of things. And then on the other side of it's just, I've been hit in the head, I don't know if I'm going to die or not. I'm
right,
just not sure what
extremes.
to do. Yeah. And even when I was first getting into kind of, I'd been studying neuroscience and neurology for a little while, but I actually saw a comedian on TV. I think his name was Drew Lynch, and he's a comedian who he has a stutter and he's kind of had a brain injury. But one of the jokes that he told on the thing was, part of the brain injury that he's got was because he went to sleep on a concussion, and he was like, and now I know you're not meant to do that. And that was a whole joke, but that scared the crap out of me because that suddenly became like, oh, actually, yeah, like I think I can understand the brain, but if going to sleep is pretty important as far as I'm concerned. How do we deal with that? And I was wondering if I could ask you specifically about things like that, like those kind of rumors that get thrown around, like you're not meant to sleep on a concussion, or you're.
Yeah, let's start with that one.
Let's just see what's on that.
So that's kind of right and kind of wrong. So the old myth, the thing we still kind of hear all around, is you need to wake someone up every 2 hours, right? Or you don't let them sleep. So let's fine tune that a little bit. So when a concussion happens, it is truly, I always say it's a metabolic, physiologic, and microstructural injury that has happened to your brain. So there is this process happening, right? That process can evolve over a period of 4 to 6 hours. Okay. There's also potential, depending on the mechanism of how you got your concussion, that maybe you do have that slow bleed, right? We call it a subdermal hematoma. It is a slow bleed. It doesn't show up right away. And so but it will evolve over that 4 to 6 hours. So when you first get a concussion, you don't want to sleep for the first 4 to 6 hours, because that's where you're going to start to notice if someone is decreasingly losing consciousness, or they're starting to have a harder time with their words, or their headache is getting worse. If any of those symptoms are evolving to that degree, then it's straight to the emergency room. But after that 4 to 6 hours, if there was no red flags initially in the presentation of a concussion, we can talk about those if you want to, but if there was no red flags initially, and if it hasn't evolved, and then let people sleep. You don't need to wake them up every 2 hours. You don't need to keep them awake for 24 hours. After that 4 to 6 hours, if everything is good and nothing's evolved or gotten worse, you can let them sleep.
Yeah. So it's actually just, I guess, paying close attention at the beginning. And then I guess, like those red flags that you talked about, what should be, if someone gets hit in the head or like a whiplash injury or anything like that, well, what do you normally recommend people to watch out for, or what should they do right away?
Yeah. So any scenario. So, I mean, it's funny because most people still think, I did a poll once on my Instagram, and it was this question. The question I asked was, why didn't you think you had a concussion? Because over 50% of concussions don't get missed. They don't get diagnosed. So it was like, why didn't you think you had a concussion? And the majority of the answer was, because I don't play sports. So quick clarification, obviously anyone can get a concussion. And the highest reason people actually get concussions, the highest statistical reason, is from falls, just period. Falls is the biggest reason people get concussion. But we think of car accidents, work incidences, right? So it's not just on the sport field or the ice or the pitch or whatever the heck it is sport you play. So if you have an incident, whatever it is, where you've hit your head or there's the potential that a concussion has been sustained, you want to remove yourself from that situation for sure. The red flags that are like, you go to the hospital or you go to the doctor right away, right, are obviously you've lost consciousness. You have numbness or tingling kind of in the arms or the extremities of the body. You're seeing double vision. You have tons of neck pain or head pain, nausea, vomiting, seizure-like activity, or we call it posturing. So when you have the concussion, your body goes into this interesting posture. Those are word finding or memory issues. So my son races BMX, and we were at the BMX park. There's a big jump park and the track and all this stuff. And there was a kid who 100% got a concussion, and he was repeating the same sentences and the same questions every 2 minutes, like hospital. So those are those kind of immediate red flags. If those things aren't showing up right away, but then over that period of time, you start seeing them like, okay, so now they seem to not remember what they've talked about, or they just seem a little bit more fatigued or more like tired, or they're slower. So it's like that slowly decreasing consciousness. They're complaining of increasing neck pain or increasing head pain. All of those things are reasons to still go to the hospital. And then concussions don't show up on imaging. So CAT scans, x-rays, MRIs, we can't see a concussion on those, but they will do those imaging if they're concerned of something else, if they're concerned of a bleed or a fracture or something like that, because it will rule out those other serious injuries as well.
Yeah. I remember actually being in Brazil and seeing a show where one of the performers got hit pretty hard on the head. And the next day we were kind of going, oh, so what, like, did you get diagnosed with concussion? And he kind of went, well, no, because in Brazil we just don't do that. Like we don't really even consider it a thing. We deal with the more serious symptoms afterwards, but for a concussion they just sort of go, well, yeah, you're concussed, there you
go back in.
Just like have a rest or do whatever it is you want to do. And they also said, yeah, don't look at screens, which was another rumor that I thought I might ask you about, well, like how much validity is in that.
So I've actually watched this go through a couple different phases now, to be honest. So there was a phase where it was like, don't do screens, like it's not going to help. And then there was a phase where it was like, you know what, do them, but in those first 48 hours, like it's fine. But if you start to flare your symptoms, like come off of them. But there was a study that just came out actually, like within the last, I think it was this year, actually, it was either this year or the end of last year, that looked at acute concussion recovery and screen use. And they found that the people who eliminated screens in the first 48 hours had a faster recovery rate than those who didn't then use screens. So now, based on that study, I'm telling people no screens for 48 hours, or if you need to use a screen, like minimal. And then after that 48 to 72 hours. So anytime someone gets a concussion, it's 48 to 72 hours of rest. And then it's a gradual reintroduction of activity in life, right? So you don't dive back into life, but it's a gradual reintroduction of activity. And so now, based on this recent study that came out, that it was like I'm trying to remember it was a significant, like I feel it was like a 5-day difference in time of the people of recovery, of people who didn't use screens versus those that were allowed to use screens. And it was in those first 48 to 72 hours. So now I say no screens, or like super minimal, because I do my check-ins via an app with my clients. So it's like, I want you to do the check-in, but then I want you to put your phone away. I want, if you need to talk to your friend, like have a conversation instead of texting on a screen. Based on this recent study, that it was quite a significant difference between those that they eliminated screens for this first 48 to 72. But then after that, like after the research does not support strict rest or restriction of activities after 72 hours, it's a gradual introduction of stay below symptom exacerbation. So if screens are bothering you, you're on a screen for like 3 minutes and then you start to get pounding headaches, like, yeah, okay, don't go on your screen. But then let's also start to figure out if this is persisting. And this is where I come into play with my clients. Obviously, if things are persisting, what is the root cause of why these symptoms are still happening? And then let's treat it. Let's not just try to manage it.
Yeah. And that's actually what I was going to ask you. The next was about like these, because I guess that's a lot of the time when we are working with people, it is always like, it's whatever you're doing, if your symptoms are coming back, you're doing too much of it or something like that. And a question we get a lot though is like, well, what do those symptoms actually mean? Like why? And given what you said about this is a 5-day difference in recovery, for some people it's like, oh, well, if I can still do my thing, I'll wait 5 days. But is that like, what is the potential of that those symptoms might lead to, or I guess?
Yeah. So I'm a big proponent of getting to the root cause of a symptom and treating that to then address the symptoms, as opposed to just managing the symptoms. And the example I say is, there's, depending on where you read, anywhere from 5 to 7 different kinds of headaches, right? A headache is a symptom. Yeah, I could take Tylenol and that manages the headache, But I could also find out why that headache is happening, treat that, and then the headaches go away. Right. So it's are you going to manage the symptom for the rest of your life, or are you going to figure out why the heck it's happening and address it so that you don't have to manage it for the rest of your life? And I think sometimes there's still this lack of education. This is what, like, a part of what we're trying to do too, is say, you don't just have to live with these symptoms. You don't just have to manage symptoms. We can figure out, ideally, where the root cause of the symptom is coming from, treat that, and then that will help your symptoms. So that's where I come into play with my clients all the time, right? So I see clients locally in my clinic, but I also see clients fly in from all over North America to come do what we call a concussion intensive. And they work intensely with me for 1 week. And in that intensive, we do a super detailed, it's like a 2-hour assessment where I'm figuring out and I assess the different systems, So we know with concussion that there's now what we talk about as clinical profiles or different phenotypes, right? So you can have an autonomic or physiological concussion, an ocular motor, which is your eyes, vestibular system, which is like inner ear dizziness, cervical, so neck, sleep is, some people put sleep in there as one. Some people put headaches in there as one. It's kind of a funky one. Anxiety and mood. And I'm missing one. Can't remember what it is off the top of my mind. I can't remember what I've said. Anyways, identifying the type of concussion, the clinical profile, helps us then treat that actual root cause, because dizziness, for example, everyone says I get dizzy. Dizzy is a really vague word. It's an umbrella word to describe a lot of different symptoms, but just dizziness as a whole can come from your neck, can come from your eyes, can come from your vestibular system. So if all you're doing is treating the person's neck for dizziness, but you've never assessed their visual or vestibular system, or all you're doing is giving them meds to help decrease the vertigo and the feeling of imbalance, for example, but you've never assessed these symptoms to figure out where it's coming from, then you're missing a big piece of the picture. And that's the piece, is like, we want people to know, and I want people to know, like, you can do something about this. You just have to connect with the people who treat it and understand it and do it.
Yeah.
And that's not usually the doctors.
Yeah. That seems to be like the experience I've had. And yeah, anyone I speak to is kind of, you go to hospital, they just go, well, yeah, it's not serious enough for us to want to deal with it. Go back to whatever. And how soon would you, kind of like you sort of said, those 72 hours rest when people are thinking about, come and see you, how soon are you thinking about putting in those vision or vestibular? I mean, I know you probably do the assessments, but is it straight into vision vestibular work, or is it more kind of breathing, cardio, that kind of thing?
So it depends on where you kind of, in my ideal space. So there's certain clients that I have that especially my athletic clients, for example, I have baselines on them, so they all know how to reach me really quickly. But usually I'll connect with people in the first, like within that first day or two of their concussion, and just give them that initial, like, hey, here's rest. I want you to do breathing exercises. I give them homework that's restful, but that is going to engage the parasympathetic nervous system as much as possible in the first 3 days. And then I like to see people in clinic between day 4 and 7. And so between day 4 and 7, we're going to do, so I'm not going to do a detailed assessment, but I'm going to do screens. So I'm going to screen the vestibular system. I'm going to screen the visual system. I'm going to screen the autonomics. I'm going to screen the neck. And we're going to get you started on a gradual aerobic program, because the research is showing us over and over and over and over and over again that if we can get someone started on a gradual sub-threshold, so sub-symptomatic aerobic exercise program, they improve faster. So we start on that on day 4. If there is, the other thing too, with some of those visual, some of those vestibular, some of those symptoms that might show up in those first days, they can be transient in nature up to that first week, the research is showing us. So I do my screens, but I don't give treatment usually in that first week, except for the gradual exercise and the parasympathetic piece of things. But if come day 10, our symptoms if our symptoms aren't improving, kind of after that first week, and if they're still kind of struggling, then I start to dig deeper, for sure. The research is showing us that, if day 14, if things aren't resolving, it's likely because we're looking at also the dysfunction of either one of these other clinical phenotypes. So we need to be looking more there.
Yeah, that makes a lot of sense. And I was wondering actually as well, the for the aerobic exercise, a lot of that I guess is improving the blood flow to the brain for, you know, flushing out whatever toxins, etc. Do you ever explain a bit of what's going on? I find some people find it terrified if I try to explain what happens in a head injury. But for me, I find it really useful to, are you able to talk a little bit about, you know, what actually happens in your head that, like, you know, why would you need to maybe improve blood flow or improve aerobic exercise?
Yeah, so I actually talk about it with all my clients because concussion is one of those things that it's invisible to the naked eye, right? And so we can't actually see it. So I have this diagram that I on a handout that I actually bring out with my clients, because it's this piece of, you know, I don't need you to memorize this, but I want you to understand that something actually happened in your brain. Like there's a physiological process that happened to explain why you're feeling the way you're feeling. And I know it really freaking sucks that you can't see it, but I want to show you a picture of what happened so that you understand that there's a correlation between, okay, something real actually transpired. This is why I feel this way. And it can be so validating for our clients, I think, too, right? But I keep it pretty simple because I say to them, I said, there's this thing called the neurometabolic cascade. All you really need to know is that what happens in a brain injury and what happens with concussion is it's an acceleration, deceleration, so a whiplash mechanism. It can cause shearing of the axons which are like your big highways in your brain, which translates information. And there's an inflammation process that happens as well. And basically, because of what has happened, the energy that your brain needs, which it gets from all its nutrients and its blood flow, the energy it needs to take care of this reaction that's happened is more than it has. So we're in a little bit of an energy crisis. So when you start to do things too much right now, you're putting more demand on your brain than it has the capacity to serve. And so this is why we need rest in these first few days. And then one of the things that happens, the reason, people are like, why are you giving me breathing exercises? Like, why are you telling me to put my face in cool water? Like all these things. And I say, one of the things that's been shown over and over again in concussion as well is we get this uncoupling of our autonomic nervous system, right? So we get this uncoupling from our cardiovascular system which ultimately decreases to the autonomic nervous system, which then decreases blood flow to the brain. Now, that's the most accepted thing right now. They're constantly researching blood flow and what that looks like. Sometimes it's more, sometimes it's less. Depends on zillions of factors, but blood flow can be interrupted. And this is the physiological kind of subtype of concussion. And we know that someone has this when they experience exercise intolerance, right? And so what we want to do is with this sub-threshold type of activity, it starts to increase that blood flow back to the brain and helps you with that healing process. So, oh my gosh. I'm sorry if you can hear my puppy in the background.
Oh yeah.
So it's this mix of, you know, this sub-threshold exercise has been helped to reduce symptoms. It's been helped. So one of the other things and one of the other kind of studies is what happens is people have developed carbon dioxide sensitivity, but the sub-threshold exercise has been shown to help resolve that as well. So it's just being shown over and over again to help resolve the effects of concussion and that inflammatory process that kind of happened to bring you back to your resting.
Yeah. And that's, I think, interestingly as well, we always recommend usually like treadmills or exercise bikes for a lot of people, just because like what you were saying about maybe there's a vestibular or vision problem. Actually, if they're going to go for a run or something like that, or do lots of lunges where their head's moving up and down and actually the light is changing, we kind of tell them, actually, you know, you might get away with that. It might be fine, but you might find that if you're just on a stationary bike where, you know, your head doesn't move, maybe that's gonna be a little better.
For anyone that I know that's dealing with so if anyone's got significant cervical, vestibular, or visual issues that I know of that have kind of come up in screens, it's the bike right away. For sure.
Yeah.
Because the treadmill is like exactly like you just described, like that motion that you described, that's going to flare their symptoms. So then you don't know if you're looking at, is this exercise intolerance or is this because I flared one of the other systems with the symptoms that they produce? So for those exact reasons that you just listed.
Just trying to isolate as many different parts as you possibly can. Yeah. And you kind of talked as well about that acceleration, deceleration from a kind of whiplash. Mm-hmm. And that's one of the things that I found interesting as well, was that people, like, you don't necessarily have to be hit on the head to have a concussion, do you? So actually you can get that just from any kind of fast movement of the neck. Yeah.
So the definition, when we actually look at it, thank you for, like, that's what's still one of the oldest myths out there that still perpetuates, honestly, still perpetuates today. You don't need to hit your head and you don't need to lose consciousness to have a concussion. So definition is basically, it's a biomechanical force that causes either to the head, neck, or elsewhere on the body that transmits that force up to the brain. So yeah, you do not need to hit your head at all to be diagnosed with a concussion anymore. And then, you also don't need to lose consciousness. And I think statistically, it's actually only about 10% of people who experience a concussion actually lose consciousness.
Yeah.
So it's a really small number.
And then based on that, and I think you also mentioned about people who didn't think that they were concussed. Do you deal with a lot of people who, like, way later down the line, because I guess you will be dealing with post-concussion syndrome, but are there people who, only piece it together like a long time in the future?
Yeah, so this is sometimes the tricky part, because of the yes, absolutely. It's harder sometimes, I think, for people to get support for it when it kind of starts to get pieced together later down the road, to be honest. Because of the pathophysiology of, like, so that neurometabolic cascade, that process that actually happens in the brain, if someone has a concussion from that incident, symptoms just physiologically on that timeline will show up in the first 0 to 2 to 3 days. But sometimes what happens is the symptoms that show up are subtle. And so say someone gets a concussion on a Friday, and then they have a chill weekend, and then say they're on vacation and it's a relaxing vacation, and then they don't go back to work or back to, like, regular life with their normal demands for a couple weeks, they may not even recognize that they've had a concussion because they haven't pushed or taxed their brain the way they normally would. And they've been kind of in this restorative state. So I've absolutely seen that happen. And those ones are harder because sometimes it's harder not harder to treat, but it's harder for the client to piece together why they're feeling the way they're suddenly feeling. And sometimes it's hard I've seen, like, from the doctor to be like, well, you were fine. It's like, well, they were, but they weren't doing their regular demands, right? Like, they weren't pushing their brain where they normally would. So, and it was subtle, so it got missed. And then it kind of evolved. So yes, absolutely. I've seen both of that.
Yeah. I mean, that's a huge one for us is, I mean, I know people because working with athletes and stuff all the time, and in the circus, I know a lot of people who, I'm pretty sure I was there when I think they had a concussion, and this is, years down the line, and they'll still swear by, well, no, not at all. But I still can't figure out these mood swings that I've got, or this, headache or neck pain that just keeps coming back. And, are there things, if anyone was listening and I don't know, I don't want to start suggesting to people that they might have things that they maybe don't. But if they're seeing a grouping of a load of symptoms, what would you say to look for that maybe they might have had a concussion, or maybe actually just some of the same treatments might be helpful?
Yeah, I think it's more option 2, to be honest, because the way I always look at it, I'm treating the person that's sitting in front of me today, right? So whether you've had 1 concussion, 2 concussions, I that's important to me. I want to know that. I do want to know the trajectory of what happened. But ultimately, I'm treating you, the person sitting in front of me in this moment. So if you're someone who's dealing with recurrent headaches, that's not normal. If you're dealing with recurrent neck pain, that's not normal. If you're dealing with dizziness, That's not normal, right? So if you have any, sorry, I'm losing my voice more and more here. If you're dealing with these symptoms that are impacting your quality of life, to me, that's what it kind of always comes back to, right? Like, no one should live with headaches every day. No one should live with neck pain every day. A lot of people choose to be honest. A lot of people are like, it's just, chronic neck pain is just kind of what I got. But if it's impacting your quality of life and the way you want to live your life, then connect with somebody who can help you, right? We talked about a little bit earlier about, I'm a huge proponent of what I call a multimodal assessment and treatment plan, because I don't believe that our body and like our minds and our bodies, can't be separated at all. And our systems don't operate in silo. They communicate, they integrate over and over and over again. So neck pain, for example, when someone has chronic neck pain, a lot of people think I'm going to go to a physio or a chiro or osteo or whatever, whoever, exercise physiologist. There's some really skilled professions out there. And they work on the neck, right? And they work on the neck and they work on the neck and they work on the neck. Oh, my chronic neck pain is never going away. I've seen all these people, they've worked on my neck. It's not happening. Well, the neck can also be impacted by your eyes. The neck can also be impacted by your vestibular system. So what I say to people is, if you've tried something, and I'm going to say, don't just try one person. Like, one person, it doesn't represent an entire profession, right? So, but if you've tried a few different things that are all kind of manual therapy based, let's say, and it's not working, then be open to trying a different approach. Be open to trying something different through a new lens, or someone who does, or like looks at kind of that more whole picture and what else could be impacting this besides just like the manual, the tissues, the bones, the nerves around the neck. Like, where else could this come from? That would kind of be like my overarching, like, if you're dealing with any sort of symptom that's recurrent, A, that's not fun and you shouldn't have to. But B, ask yourself this question, like, is it impacting the quality of life or the quality of life I desire to have? And if it is, connect with someone who can help shed some light on it. I have people that come to me who I'm like, I am not your person, but let's find you someone who is, right? Like, we all have, I'm sure you guys do too, we all have our referral networks that we refer to because we all want the best outcome for our clients. And a lot of the time that's working with ourselves or like with you, with your clients. But sometimes it's, you know what, I'm going to refer you to Jack down the street because here's what I think might be happening. And he might be able to support you better than that. And that's the beauty of team and healthcare.
Yeah, it's really interesting because I guess that's part of the thing about when you go to see the doctor is they always tell you this is what you have. But part of that is because if they don't, then you go away going, oh, that's a terrible doctor. He couldn't tell me what was wrong with me. And that's just become the accepted thing that, we go to the doctor, they should know what's up. And if they don't, it's because they don't know what they're doing, not because maybe I'm a little complicated, or maybe they're just the human body's a little bit complicated.
Yeah.
And there's kind of two sides to that, isn't there, though? Because, you could go, well, I've got this neck pain and head pain. That could point to, oh, maybe I had a concussion years ago, and so I should get that sorted out. But actually, it doesn't really matter. If you make it better, then does it matter that it was a concussion or that you had, vision problems, or, you've just got very focal glasses, so suddenly you're having to use your head more? As long as you fix the problem, then it shouldn't really matter. But then a lot of people do feel better knowing, or they believe the problem can be fixed if they know what it is. So if you tell me, yes, I've got a concussion, and then you go, but don't worry, concussions can be fixed, then it's cool, okay. Whereas you go, I don't know what's wrong with you, but the good news is that doesn't matter. Like, headaches can be fixed.
And I think there's going to be certain things that come up, say in an assessment, that you're going to be like, you know what, like, this just looks like a vestibular hypofunction, or, this could have come from a concussion. Or the person assessment is going to be like, they're going to pick up on, like, you know what, I think we need to refer you for some, like, a more lookup, right? So I think too, depending on what the symptom is, obviously, and what's showing up, there's going to be those times where, you know what, this could have come from that fall, or this could have come from that concussion. But let's work on this together. Or it's going to be, you know what, there's a couple things I'm uncertain about here. Let's kick you back to your doctor and let's get a referral to an ENT or a neurologist or whatever it is, because here's what I'm seeing. And I would just like to look at this a little more closely. And that's definitely happened. Like I've had clients come in who's got like, he was diagnosed with a just like weakness. He's like orthopedic that was coming in, and he walked into my clinic and I was like, oh no, like it's that. And I was like, and called his doctor and got him a referral to neurology, because the second I assessed him, I was like, he's got MS. Like there's no question, right? There's been people that I've assessed who've come in with potential concussion that I've assessed that I'm like, you know what, some things just aren't clicking. Like, let's get an MRI. Like, let's kick you back. I just want to be sure. Right. And so when you see someone or a healthcare provider who kind of has that skill set and knows what they're looking at, they're going to kick you back ideally to your, well, in Canada, your GP has to be the person that orders everything, your general practitioner. So that we're going to kick you back to your general practitioner with a note saying, hey, like, this is what I'm seeing on assessment. I feel like we need a referral to X, Y, and Z. Like, can we look a little closer at this? Because then they'll get that label and that title to help them kind of navigate the system better too, to be honest.
Yeah, that definitely makes sense. So I wanted to also, just because I know we don't have loads of time left, and we've kind of covered a bunch of topics, and I wanted to just make sure if anyone's tuned in specifically because they're worried about either they've had a concussion or they might have a concussion or they know someone, I wanted to see if we can just go through like a general, we've talked about some of it already, but just the general, like, you know, all right, you've just been hit in the head. We're saying 72 hours of no screens and kind of general rest. And then what are they gonna do next? Well, actually red flags, I guess, first, and then
so if you have it, so you experience a concussion, you're ruling out those red flags first. And on my Instagram, I think I've posted what the red flags are about 7,000 times. So you're ruling out the red flags. If there are red flags, I always say if there's red flags or you're just really uncertain, go to the hospital and just make sure, and then they'll rule out those red flags for you. And then from there, it's no sleep for 4 to 6 hours, just to see if something more serious evolves. And then after that, you can sleep, right? You can have a great night's sleep. You don't need to wake someone up. You're going to do 48 to 72 hours, depending on the person, of rest. And that means actual rest, like sleep, breathing exercises, listen to an audiobook, relax. You can have conversations. You can try and watch a little bit of TV, but you don't want to do anything that flares your symptoms. And by screens, this is actually where it's like computers, cell phones, tablets, those sorts of things. No screens for the first 48 hours either. And then after 48 to 72, this is where we start gradual reintroduction of activity. So both physical, like aerobic activity, and general activity. This is also where I say, please connect with a health provider who can support you.
Yep.
The research is showing us again and again, the sooner you connect with a health provider who can support you and understands concussion, the better the trajectory of your recovery is going to be. There's a lot of little questions that come up in these first phases, and having someone to bounce those off is great. Because on that day 3, day 4 is when you're going to start doing aerobic activity, staying below everything you do in this first week is to stay below elevating your symptoms. So if you push your symptoms and you elevate your symptoms, you need to stop. You need to rest. Pushing through is not going to get you anywhere. It's going to slow you down. That's for the first week. And then 1 week to 10 days. And then between that 10 to 14 day mark, if we're still experiencing, if we're not showing improvement, that's when we start to look at a little bit more detailed kind of treatment and things like that too. So the rule, kind of what I say to everyone is, don't try to figure it out on your own. Truly do connect with someone who they are knowledgeable in this area. And I can't even say what profession that would be, because honestly, there's so many professions that work with concussion: physical therapy, chiropractic, osteopathy, exercise physiology, kinesiology, athletic therapist, the list goes on. But what I will say is it's usually someone that falls into that allied health professional range. It's not the neurologist, it's not the doctor, it's not the physiatrist. Yes, we need those people on our healthcare teams, but they're not the people who are going to rehab you through this process. But that would kind of be the short, initial piece, with the biggest advice being just connect with someone.
Yeah. Well, once you're connected with someone, then you're you've got someone for all the other steps.
Exactly.
And like, that is the thing. I mean, I don't know how it is in Canada, but then the big worry that people have over here all the time is, oh, well, how much is that going to cost me? Because as we said, well, I'll go to the GP, but the GP will say, or, go to hospital. If hospital is fine, you're okay. Or are there any resources? I know for a start, your Instagram account is amazing for
Thank
just
you.
information about concussion. I've been following that for a few years now. Just Natasha Wilch.
Natasha.Wilch.
Wilch, yeah. So definitely check that out if you're curious about finding things out. Are there any other online resources that you recommend for people, or just stuff that people can find for cheaply or free, just in case?
Yeah, there's, oh gosh, for that acute phase, I mean, there's tons. I mean, and most people, like, I respond to every single message I get as well on Instagram. I won't give you medical advice. And I would say too, I talk about putting activity back in there. There's a lot of different resources for the persistent concussion phase out there right now. I honestly, in terms of Parachute Canada is a resource that has, like, they have tons of resources on there. There's a website called CATT, CATT online that has a bunch of different, like, free resources as well, and videos. Heads Up is another one that has a bunch of different free resources and videos. The University of Calgary, obviously I know a lot of Canadian resources. The University of Calgary used to have, I don't know if they still do, but they used to have a free, like, little course that you could walk yourself through to get some more information if this was an area that interests you, to kind of educate you on the processes as well. For there's a whole bunch more for persistent, like, there's a lot of community-based educational resources for persistent concussion. But that acute bit, then here's the nice thing too, is if you connect early, you shouldn't have to spend tons of money.
Yeah.
Right? 80%, 70 to 80% of people recover within the first 2 to 4 weeks. Right? So I would say, and I know everyone's different in their healthcare and insurances and stuff but it would be worth the investment in yourself, at least for that initial appointment, to get some guidance, because I guarantee you that provider is going to have resources for you as well. Yeah. So it would be worth that initial investment in that one appointment, at least for yourself, to get guidance, to help set you on the right path, because taking care of yourself in this acute phase is one of the biggest predictor of people developing persistent symptoms. And I don't want you to go down that road. Yeah,
that's a bit I really think is best to highlight and why I kind of brought it up, because I know a lot of the times when people hear, like, oh, see a professional, and it's just
this is one that I just invest in at least the one visit.
You can mitigate so much, but also that's a lot of resources, and if people need to send you a message as well, that is
they are more than welcome to.
Amazing. So Natasha, we're going to have to start finishing up, because I know we've got a cutoff time. So all I want to say is thank you so much for that. That's a ton of information, explained really, really well. If anyone is interested in that stuff, as I said, definitely go check out Natasha.Wilch on Instagram. There's so much information on there. Reach out with a message if you've had a concussion experience and symptoms, anything like that. But yeah, I would be happy to come join you again as well, if your audience felt like that would be great. Amazing. Yeah, actually, if we get some questions in from people that they want to ask, we might even just get that arranged.
I would be happy to do so.
Well, I'll let you go and enjoy the rest of your morning then. Thank you very much again, and hopefully we'll chat again soon.